when I was about 40, things changed and my asthma suddenly became quite severe and quite difficult to manage. And that's the situation that I find myself in now. It's quite unpredictable. And it interferes a lot with my life. I used to be a kind of clarinet playing, singing, swimming, dancing, drum playing. I used to swim about a mile a week, go to the gym 4 times a week, and I really struggle to do things now. I do like to try things. It does get me down sometimes. You can look all right, you can sound okay, but then just getting dressed in the morning, getting dried after a shower, putting your clothes on, putting washing in the washing machine can make you quite breathless, and that's just really frustrating. Inside, there's a very active person who wants to get out, who's often quite thwarted by what's going on in my lungs. But I don't think you should stop doing things because you've got asthma. That's not what I think at all. When you are in the midst of an asthma attack, it's as though for a normal person, normal lungs, that you were trying to breathe through a straw and that you bent the straw back on itself, squashed the end, and you try to breathe through that straw. And that's kind of what it feels like when your chest is what we'd say is tight. Yeah. Give it a try. It's not very glam, is it? It's not very glam to have a hacking cough and sound like a set of bagpipes. Just stop and think. I think it's probably the same as with any physical limitation that anybody has. Just try and understand and just listen to me for a while. I think that's it, really. If the British Lung Foundation had 1/10 the publicity that Cancer UK has, it would help. That's not to say that Cancer UK shouldn't have it, it's to say that British Lung Foundation could do with it as well. I don't know. We don't seem to get the same, excuse the pun, airtime as other charities. I would say if you've got asthma, don't be frightened of it. Show it respect, but don't be frightened of it. Learn how to cope with it, learn how to manage it, and get on with your life. And if you've got a child or a parent or a brother or a sister with asthma, be patient, be supportive, and encourage them to do those things I've just mentioned. It doesn't mean that your life's over and you can't do things. There are athletes doing amazing things who are asthmatic, but you just have to learn to live with it and do the best you can.